Hi, I'm Otis Sharp. I'm a registered nurse and a trauma nurse specialist. Also an emergency medical technician. That's a credential I've had for 20 years. I've been taking patient vital signs for most of that time. And today I'd like to talk to you about vital signs and specifically about blood pressure. This is my daughter Savannah. She's going to help today. So vital signs, there are 5 different vital signs now. There's respirations, that's how many times you breathe a minute. Pulse, how many times your heart beats in a minute. Blood pressure, which is what we're going to be specific about here real shortly. That's measured by millimeters of mercury, and it measures the exertion on your arteries both during the beating of your heart and your heart at relaxation, systolic over diastolic. Temperature is also a vital sign, and pain scale is a vital sign now. That's the only subjective vital sign. Everything else is objective. So deviations in vital signs would include higher or lower than you would expect. Temperature would be hyperthermia or fever. Low would be hypothermia. Typically you would only see that in exposure to the elements. Pulse, if it's high, can be related to drugs or a specific type of conductivity problem. Same thing for a low heart rate. Respirations are affected by pulmonary disease. Probably won't really get into that specifically. Pain is self-explanatory. But deviations in blood pressure would include the possibility of dehydration, bleeding that could lead to a low blood pressure, kidney function, sodium intake, pain, and drugs can actually cause it to go high. The 2 instruments we use to record blood pressure are the sphygmomanometer, really fancy word for blood pressure cuff, and a stethoscope, what I call a heart listening to thingy. So this is Savannah's left arm, and we'll use that for today's exercise. We want her heart to be on the same level as her arm here. This is her brachial pulse. I'll feel for that. It's right there, right where we expect it. So we'll put this on her arm. She's been sitting here still for a few minutes. A good resting blood pressure, the patient will be sitting still for 5 to 10 minutes. So we'll put the stethoscope in place, hold it with fingers, not thumb, because we can actually hear our own pulse. If we do that, totally deflate the cuff. Now we'll close that, start to inflate. I can hear her pulse. Still hear it? Don't hear it anymore, so about 20 points above the point where I don't hear a pulse anymore. I'm going down now. Oh, a little too fast. Being a good patient. Listening. Great. Well, we got 88/48. Which is the fine blood pressure for a 5-year-old, which she is. So today we discussed vital signs, specifically blood pressure, deviations in blood pressure, the instruments used to take a blood pressure, and I hope this helped clarify the idea of blood pressure for you. Thanks.